Good afternoon, everybody. My name is Winifred Quinn, and I am at AARP's Center to Champion Nursing in America, which is a joint initiative of AARP, the AARP Foundation, and the Robert Wood Johnson Foundation. I'm going to cover the topic of basically empowering a healthcare workforce to help older adults remain in the community and live higher quality of life. And where there's been an emphasis on, and a necessary emphasis on, the need to properly fund a healthcare workforce to care for older adults, I'm going to feature or stress the importance of empowering that workforce so that there is more efficient care and so that people can remain in their home. I'm going to cover two definitions of a definition of nurse delegation and a definition of consumer-directed personal home care. And I'm going to underscore the fact that what I'm discussing will be about home-based care and not acute-based care, or even assisted living or nursing home. This will be home care. So the first concept I wanted to educate you about is the issue of nurse delegation. And that's basically a practice where a nurse, a registered nurse, can hand off a task that normally would be under her or his purview to a direct care worker, say a home health care aide. And possible such tasks would be medication administration, which ends up being probably the stickiest point in the issue of older adults being able to stay at home and get care. Then tube feedings, bladder regimen, enema administration, ostomy care, and respiratory care. Then there's the issue of consumer-directed personal home care. And this ties in with one of the new models of care, or a new model of care that Dory was discussing about the need for our healthcare system to have new models of care. And this is where a person who lives at home is able to direct the care that they're being provided so that they can train the aide who's helping them. They could hire, train, and possibly even fire their care worker. And at sometimes the consumer-directed model can also fall within the caregiver, the family caregiver, if the consumer or patient themselves is unable to direct their care or delegates that task to their family caregiver. And there's been numerous demonstration programs and research that's been done in this area. Pam Doty with the Department of Health and Human Services ASPE office, the Assistant Secretary for Program and Evaluation, has done a lot of work in this area. She and ASPE and the Robert Wood Johnson Foundation had created the Cash and Counseling Demonstration Program, which is now a national office and focuses quite a bit on the issue of consumer-directed personal home care. And there is an intersection between nursing delegation and consumer-directed personal home care. I'm going to back up. The consumer-directed personal home care is normally practiced with a younger adult population, younger adults with physical disabilities, where they're able to direct their care. There is an intersection between nursing delegation and consumer-directed care, where the consumer can rely upon the nurse for helping to train the care worker and to update the patient themselves or the care worker on the care that's needed. But sometimes the patient might not even want the nurse to be involved, and I think that's okay too. So in addition, now shifting from the definitions or the concepts of nursing delegation and consumer-directed care, I wanted to talk to you about a pilot study that's featured in the Generations publication that you have. It was conducted by my boss, Susan Reinhart. She was unable to be here today, so I'm here in her stead, basically. But I have a history of doing research with Susan on the issues of consumer-directed care and nursing delegation. So that's why she tapped me to be here with you instead. So Susan's paper focused on a pilot study in New Jersey on the issue of nursing delegation of medication administration to home health aides. So in New Jersey, the Nurse Practice Act in New Jersey allows registered nurses to delegate medication administration, but it's actually specified that they can't delegate to home health aides. So it's to me, from a consumer perspective, that's frustratingly ironic. But it was done because that provision was included because the home health industry actually was very concerned about liability. So, so what happens when people can't stay, when people can't actually receive the medication they need? And I'm not talking about, just insulin. I can also be talking about needing to take a Tylenol, trying to open up a Tylenol bottle, right, to take some over-the-counter pain medication. So very basic stuff could actually ultimately mean that a person ends up being institutionalized in a nursing home or maybe needing to be hospitalized because they're not getting the medication that they need. So what does that do? Well, it means that the consumer themselves has less of a quality of life. It also drives up costs, especially Medicaid costs, because it's a lot less expensive to care for somebody at home than it is to care for them in a nursing home.